It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested. So it's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested. So
what do the numbers say about the deaths? Of the 16,387 deaths registered in England and Wales during the week ending the 3rd of April, around a fifth, 3,475, mentioned novel coronavirus. But the Office of National Statistics said there were 6,082 more deaths during that week compared to the 5-year average, which raises questions about the reasons behind the remaining 2,500 additional deaths. Coronavirus. Expert warns lockdown is causing additional deaths. A public health expert has called on the Scottish Government to give the public a clearer understanding of the lockdown exit strategy as fears grow that deaths are rising among people who do not have coronavirus. Linda Bald, a behavioural scientist at Edinburgh University, said that people with potentially fatal illnesses were avoiding their GPs after advice that the health service was becoming overwhelmed. Others have been drinking themselves to death sitting at home, she said. The number of deaths in Scotland last week was 60% above the 5-year average for the first week of April, but only about a third of the excess was attributed to COVID-19. Hundreds of extra deaths not linked to COVID-19. The collateral damage from Scotland's lockdown has grown after hundreds more people died unexpectedly last week. Public health experts were shocked to find an additional 364 deaths in the first week of April that were not attributed to COVID-19. National Records of Scotland published its second weekly coronavirus bulletin yesterday, which revealed an excess 261 deaths. There have now been 1,515 more deaths under lockdown than in an average April. Only 962 have been attributed to COVID-19.
It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested.